Hello, this is Glenn Gruby, and today's video is about thyroid medication and why it is so hard to dose. It can be very challenging to get the dosing right of thyroid medication, and I want you to understand what you can do to make this work easier for you. Often, we find that the doctor has to constantly adjust the dose to get it right, but really it's not the doctor's fault, and we're going to talk about why that is today. It's important to know that thyroid hormone must be dosed in a very tight range in order for you to feel well. So if it's a little too high or too low, you might not feel as good as you can. So there's a number of reasons. We're going to go through them here. So the first reason is that most people are prescribed an inactive form of thyroid hormone called T4, and this has to be converted in the body to T3 to be metabolically active. T3 is what the body actually uses. But if you can't convert it well, then there will be a problem, and I'll talk about why you might not be officially converting your hormone to the active T3 form. So you might have enough T4, but if you can't use it by converting it to T3, that can be a problem. So some things that can cause this are high stress levels, because stress inhibits the conversion of T4 to T3, and it also raises levels of what's known as reverse T3, which is metabolically inactive. So when you're under stress, which most of us are, the adrenals take over the metabolic processes for the body and the metabolic needs, and the thyroid tends to go a little bit inactive, which makes it difficult to have normal levels of T3, the active hormone. So it's very important that we lower or eliminate stress to have properly functioning thyroid metabolism. Another reason is that demands vary from day to day of our thyroid hormone based on how active you are. But if you're taking the same amount constantly, then it's difficult to predict what your day will be like. And that's why some days you feel good and some days you feel bad. Next reason is that most hypothyroidism is caused by an autoimmune disease, and most of your immune system is in the gut. So if your immune system is attacking your thyroid, the medication may not be the best or only strategy that you can use. Now, if you have Hashimoto's, your doctor might say, well, there's nothing we can do about the autoimmune disease, but we know now that there are things that we can do to help improve the functioning of the immune system. So you might need to focus more on the gut and what's provoking the immune system, such as food allergies, parasites, and infections and dysbiosis. These things need to be identified and ruled out. Next is nutrient deficiencies. If you're making enough thyroid hormone or you're being dosed properly, but you're not converting it because of a lack of probiotics, or your selenium levels or your vitamin D levels are low, then you might have trouble converting your thyroid hormone again to the active form. And it will be difficult for your doctor to dose correctly and adequately to meet the needs of the body. And this can be especially tricky with vitamin D because our blood values tend to vary quite a bit from season to season. Another factor can be estrogen dominance. This means when you have a relative excess of estrogen compared to progesterone. This is mostly found in women. And this is a problem because estrogen competes with thyroid on what are known as transport proteins, or little boats that ferry the thyroid hormone around the blood. And so you can have an inhibition of thyroid hormone if you are estrogen dominant, which can affect the thyroid hormone availability. And estrogen dominance can often be seen in women with weight gain in the hip and thigh areas, hot flashes, and menstrual irregularities. Those are all clues that there may be an estrogen dominance situation. But also fat cells make estrogen, which exacerbates the problem, and all of these things make it hard to dose correctly. The last area is dysfunctions in the liver, kidneys, and or gut. Really, this is a peripheral conversion issues because your T4 is converted in these areas to T3. And this is critical to making your thyroid hormone activated so that your body can use it. So especially we want to look at there's problems with liver metabolism and gut function, because 80% of your thyroid hormone T4 is converted to T3 in these two areas. So if there are metabolic processes that are less than ideal, or if you have dysbiosis, then you can have trouble converting T4 to T3. So just keep all this in mind when your doctor is trying to dose correctly. There are a lot of variables that can contribute to good conversion or bad conversion, and it's important to look at these. And they are all important to consider, especially when the dose is difficult to get right and you're still not feeling well despite whatever dose you're on. So I hope that was helpful, and you can see why it can be so complicated to dose your medications. As always, if you have any questions, you can call us at the Functional Health and Acupuncture Institute. We'd be glad to try to answer them or help out. And I want to thank you for watching this video.